Hi, I'm Corinne, the Smile Advisor here at Dentistry on the Clyde, and today I'm with Morvern, one of our pain-free dentists, and we're going to go over some commonly asked questions that I get on the smile assessment appointments. So Morvern, what is Invisalign treatment?
So Invisalign is a really clever treatment where you wear a series of clear aligners. You wear each one for an average about a week at a time. Each aligner gradually just puts a little bit of pressure on the teeth, and week by week as you go through the series of aligner moves the teeth into a much straighter smile. It has a lot of advantages over other orthodontic treatments, one being that we can use our 3D scanner. So we use our 3D scanner instead of having to take impressions now, so it's the horrible, uncomfortable feeling of having all that pressure material in your mouth is gone, no more gagging. Also, it uses a 3D ClinCheck model, we call it, so your treatment is very planned. And it means that we can show you your 3D model, so what your teeth are going to look like before you've even begun treatment, which is what patients love, being able to visualise what their end result is going to look like before they've even begun treatment. And one of the main advantages of Invisalign is, of course, that it's so discreet. It's very hard to see that you're even going through treatment. I've got a lot of mothers and teachers actually that have had Invisalign done and have said that the kids have not even noticed that they're going through any sort of orthodontic treatment at all.
Great, so how do I know if I'm suitable for Invisalign? How do you know if you're personally suitable?
Invisalign is great because it can treat a wide variety of common concerns, so from crowding to spacing, overjets, open bites, and it can treat anything from very mild cases. One of the quickest treatments that I've done has been just 6 weeks of clear aligners. And it can treat really complex cases as well, where we work along with sort of some of the implantologists to create space for implants. So it's a great range that it can treat, but the only way that you can really know for definite if you're certain is to have a look at your teeth. So it's really important that you come in for a full assessment before we can say thumbs up, yeah, you're good to go.
So what is the treatment process in Morvern? How does it all work?
So if someone's interested in Invisalign, they'll give you a phone to yourself, phone Corinne and say I'm interested. We'll get you in for a wee chat with Corinne, and then we get you in with the dentist and do one of those full assessments that I was talking about, and it's really just to check that your teeth are healthy enough in order to move. And once you've got the go-ahead, we then use the scanner to scan your teeth, and we create the 3D ClinCheck model, and after a bit of planning, we'll get you back in to show you your ClinCheck model, and you can actually even say, do you know what, Morvern, I want that one a little bit further forward, I want that tooth a little bit more twisted. Yeah. We can sort of customise your smile essentially, which is great. Once we're happy, we get your aligners made and you come in for your fit appointment, where we give you your patient kit and fit you with your first clear aligner. That first aligner I get you to wear for 2 weeks, just as patients get into a routine of wearing them, just to make sure they actually are wearing them. And then after that, you come in every...
So can you eat and drink with them in then when you're doing that as well?
Of course, yeah. So that's one of the beauties of Invisalign as well, is that you wear your aligners all day, every day. With them in, you can have clear water, clear liquids, but anytime you eat, you take them out, you brush and you put them back in again. So if you enjoy your food, you're not restricted like other orthodontic treatments. You can have whatever you want to eat as long as you take your aligner out, brush your teeth and put them back in.
Put them back in again. So will it be painful? Is it going to be sore when I'm changing these aligners?
Common question that we get. I've had Invisalign treatment done myself. I did it to myself as a patient, and so I can speak from experience that no, it is not painful. The way to describe it is it's like a tightness, tenderness when you put in a new aligner. So if you're wearing each aligner for a week at a time, so say day number 1, 2, 3 of that aligner is going to feel tight. As you get through treatment, you actually start to enjoy that feeling of tightness because you feel like it's working, your teeth are moving. Yeah.
Fab. So how long does it take usually your Invisalign treatment?
Again, it depends a lot on how much movement requires. So someone with really mild overlapping of their front 2 teeth that just needs movement of those 2 teeth is going to be a much quicker treatment than someone that has quite a lot of crowding of their teeth and need to remove all the teeth. That's going to be a longer. Again, we need to have the full assessment. At that full assessment, I will be able to give a guesstimate of how many aligners. I'm getting quite good at the guesstimates. But it's from the 3D ClinCheck model that we'll be able to tell you exactly how many aligners you need and how many weeks your treatment will take.
Fab. And one of the other questions that a lot of our patients ask is, will my teeth move back to like what they were like to start with? Is it going to move back to what I had before? Is it going to stay the same?
If you don't wear your retainer, yes, they will.
Yeah.
But here at Dentistry on the Clyde, we have a bit of a retainer protocol where we will fit you with two retainers after you finish your treatment, and that's all included in your cost of the treatment as well. So first one is a fixed retainer, which is a bonded wire that we place behind your teeth so it's not visible to anyone, and a removable retainer, which is just like your aligners, and you wear that every night when you go to bed. And each retainer can weaken with time. Each retainer only requires replacement every 1 to 2 years, so we'll check them every time that we see you for your 6-month checkup. We can replace them if need be in order to ensure that your teeth will not move. And we say retainers for life, and I get my patients to chant that as they leave.
Retainers for life.
Retainers for life.
What's the price for Invisalign then? What are we talking price-wise?
Without seeing your teeth, we can't really give a price. So Invisalign comes in different packages depending on how many aligners that you need. And the analogy that we use, it's like phoning someone and say, how much is it to paint my living room? I don't know, I've not seen your living room. So I don't know how much your Invisalign is going to be until I see your teeth. At that full assessment appointment, we'll be able to tell you what Invisalign package that you're suitable for. And of course, we can go through all the payment options that are available, for example, the interest-free over 12 months as well.
Great, that's fab then, Morvern. So if you're interested in finding out if you're suitable for Invisalign, how much it's going to be, then please contact us here at Dentistry on the Clyde. Thanks very much.